Boston, I am joined with Maia Raynor, a Boston native and certified doula, and also serves as the Maternal and Child Health Program and Policy Manager at the Department of Public Health. Welcome, Maia. Excited to have you in the studio.
Thank you. I'm so excited to be here.
We'd love to learn about you, your journey so far to becoming a doula, and share with us what brought you to this point.
So I've grown up in Roxbury, and for me, seeing people in my community having pregnancies and not really knowing where to go for information that felt accessible, for information that felt useful to them. I just kept seeing that over and over again. I studied public health, and I realized it wasn't just these one-off experiences, but really a whole issue facing particularly Black women. As somebody who is so connected to my community, being a doula really felt like the right place for me to utilize my skills and relationships to support folks in feeling more comfortable going into that delivery room, feeling more equipped with information and knowing how to advocate for themselves. And also knowing that I'm there as well to support them when they feel like they can't advocate for themselves.
Share with us, what is a doula?
A doula is somebody who provides emotional, physical, and spiritual support throughout a reproductive experience. A doula is really there to support you with education, knowing what to expect throughout pregnancy, childbirth, and postpartum. They're also there to help you create your own preferences around labor and delivery and helping you communicate that with your clinical team. So nurses, doctors, midwives, they're there to coach you throughout labor, providing support through massage, other sorts of ways to support someone and make sure that they feel really connected with their body. It is a role that's been around forever, for centuries, since people started having babies. Even if people aren't familiar with that word doula, there's a lot of history to that role.
I do think that there's sort of this ambiguous understanding of how to get access to a doula, what services are provided. What is the best way for someone to be able to get information about a doula? How do you access it? Through health insurance? Mm-hmm. And then once you're with the doula, where do you go from there?
So right now in Massachusetts, we don't have a sort of statewide system for doulas. For example, when we think about other types of healthcare professionals, there's typically like a statewide board or certifying body. That doesn't exist right now for doulas, which means that finding doula care can be very different depending on your insurance that you have, depending on the resources you have. And my work at the Department of Public Health is to try to change that so we have a more readily available system for people to get access to doula care. But right now, if you're on Mass Health, you'd be able to access doula services completely covered by Mass Health. You can call the number on the back of your insurance card and they can give you information about how to get connected with doulas. For folks with other different types of insurance, several hospitals in the Boston area have doula programs, like Boston Medical Center has the Birth Sisters program, which is a doula program that's been around since the 1980s. One of the longest standing hospital-based doula programs in the area. Brigham and Women's has a doula program, and so does Beth Israel. So right now it's very hospital-based. So those are the three hospitals where they work with doulas regularly. If you're not going to one of those hospitals, you can also reach out to doula agencies that exist, which is basically a collective of a bunch of doulas. You get to sort of choose who you'd specifically like to work with, whereas the hospital-based doula programs typically is more of just you're assigned a doula. Finally, there are private doulas who work independently, and that might take a little bit more research, but they are out there. Typically, you can find them through social media or connecting with the Earth app, which is a really great resource to finding different people to support pregnant and postpartum people in their journey.
For example, myself, if I am pregnant and becoming an expecting mom, what are the steps that you'll sort of take your client through, and what are the things that I can learn about my experience with you?
Typically, when people are reaching out to me, it can really range from where they are at in their pregnancy. For some folks who are very big into planning, they might be reaching out to find a doula in that first trimester, those first 3 months of being pregnant. Typically, it's more likely that people will reach out later on in the pregnancy, maybe 6 to 8 months.
Why do you typically find that folks reach out later versus earlier on?
Often, it's just that people don't know that they can access a doula until much later into their pregnancy. So I see, particularly for folks who aren't aware of what a doula is, once they start working with an OBGYN, maybe they've had some negative experiences in the prenatal side of things, then they start asking around like, well, what else is out there to help serve me? You know, I'm connected with this OBGYN who is great on paper, but I feel like I never actually see them at my visits, or they don't really ask me any questions. Those are sort of the experiences that sometimes lead to people wanting to find a doula. And so when you reach out to the doula, the first thing we'll talk about is just how your pregnancy is going, right? Checking in. I'll talk a little bit to my prospective clients about what their goals are, right? Like, what do you want out of your labor experience? What do you want for your first few weeks and months postpartum? And once I get a sense of that, I can see if my skills and background match with what they're looking for. And then I talk to them a little bit more about setting up prenatal visits, how to communicate with your doctor that you have a doula to make sure that they are willing to integrate the doula on the care team. That's usually what that first conversation looks like, sort of building up our relationship as doula and client, figuring out more information about their pregnancy and what their goals are so we can start meeting and having conversations about how to meet those goals.
I think it's really important that you shared the piece about the fit to understand if it's a great fit. In our conversations around maternal health, it's been brought up a lot about self-advocacy when you're working with either a physician or OBGYN or even a gynecologist, and knowing that you don't have to stay or stick with somebody just because there's already that connection, that it has to be the right fit and feel for you.
Going through labor is probably one of the most vulnerable experiences of someone's life, and so making sure you are surrounded by people who you feel like understand you, not just based off of, you know, speaking the same language, right? But when we say speaking the same language, there's so much underlying that. Just because someone speaks English doesn't mean that their cultural context is the exact same. So I think that working with a doula is really great to make sure those gaps are bridged, where people can feel like they have somebody on their side from their community in the room with them during one of the most vulnerable experiences of their life, who knows about this system, right? We have family and friends supporting and surrounding us, but I think what makes a doula a little bit different than that type of support is just the knowledge, experience of being in labor spaces, working with doctors, working with nurses, and knowing how to raise any alarm bells if need be.
Let's talk about the importance of what we call cultural brokering and having a doula that feels like they're culturally fitting for me. Others might say culturally competent. So understanding my mannerisms, my language, the way I may prepare to give birth and things of that nature. Why is that important, and what does that look like?
Cultural competency, cultural humility, cultural brokering, whatever you want to call it, to me is just critical across healthcare. When folks are being treated by clinicians who come from their cultural background, there is evidence, research, that they have improved outcomes. They avoid having a C-section or are less likely to have postpartum hemorrhage. That's something huge that the research shows us, is that there's improved health outcomes when people are working with folks from their culture. Even further, when people are working with, particularly Black pregnant people, are working with Black doulas, that we see that impact twofold, doubles. The importance of having someone in that space who can really relate to your experiences is huge, not just in terms of comfort, but in terms of actual health outcomes. When a Black birthing person is working with a Black doula, you are seeing better birth weights from infants. You are seeing less likely to have NICU stays, all the things that make a delivery or birth experience even more difficult for folks.
That sounds really impactful. And describe to us, what does the cultural competency look like? I think when we were preparing for this conversation, we talked about, I don't have to explain why I might want to get my hair braided in my labor and delivery room prior to giving birth. So what does cultural competency look and feel like?
Yeah, that's a great example. Getting prepared for birth looks different depending on your culture. I would also say what you are looking for your clinicians to do during a birth experience. For example, after you deliver your baby, you're not done yet. You still have to deliver your placenta. And so in some cultures, people actually keep the placenta and use it as a way to promote postpartum healing. When you are working with clinicians who may not understand that culture, they may not deliver the placenta in a way that allows people to be able to save it and use it for those postpartum rituals that are so important to their culture. For some folks, they're seeing like, okay, well, we've delivered the baby, time to deliver the placenta so we can just get out here and go to the next birth. Whereas for some folks, that is just as sacred as the actual delivery of the baby. Not having the same cultural understanding around that can be really challenging. And so the role of a doula is to try to, before birth, be a bridge between clinicians and patients and understanding, okay, well, this is something that's important to you. Going back to the placenta example, let's talk to your doctor before you even have any types of contractions, labor begins at all, to make sure they are understanding your needs around this. And then in the delivery space, being that person to remind, hey, we've already talked about this, let's not get carried away, because working in healthcare settings, people's priorities are always shifting, reprioritizing, and making sure a doula is really there to say, this is something that can't be or deprioritized. They are committed to doing this, and there's no medical reason why it can't be done. So just really making sure and advocating for your clients' needs and goals throughout it all.
It sounds like a doula really provides a lot of holistic support. I know sometimes folks also think of midwifery. Is there a collapse between the two, or are they two separate roles?
Midwives and doulas do work together a lot, and they are two different roles. Midwives act as clinicians, so they can actually do the delivery and be there and supporting. I cannot do that. And so a midwife, their role is really to provide person-centered care for people across the reproductive spectrum. They really are focused on being hands-off when it comes to birth and letting your body sort of lead the way.
Maia, share with us, what are expected practices and services from a doula? Can I call my doula any time of the day? What does our relationship look like?
So a doula is definitely more informal than working with your doctor, but each doula typically has their own processes and boundaries around that. For me, as a doula, I was very open with my clients, particularly around texting. It was like, you can text me at any time, but I had a sort of cutoff for calls unless it was an emergency. I also always made clear for my clients, if you do feel like there's some sort of medical emergency, I should be your second call. Whereas you want to definitely call your clinician, your OB, whoever that is, first, and then loop me in, just to make sure if you have medical needs, those are being addressed first. Calling and texting, for most clients, I'm texting them every day, just checking in, how have you been eating? How's the nausea? Like, have you been able to get that prenatal massage you were looking for? That sort of thing. Really, the relationship between a doula and a client is way more, as I said, informal. So you're talking to them more frequently about things that are going on in their lives, their emotional state, how their mental health is doing. And while a doula is not the person to be able to support all of those needs, just teasing out what those needs are so you can refer people to other types of services and experts. One of the other things on the postpartum side, because I've been talking a lot about the prenatal, but once your baby arrives, that relationship continues. Typically, I would work with clients up to 4 months postpartum. Some people work up to a year postpartum with clients because pregnancy is just the beginning. Working postpartum with a doula can look like getting support on breastfeeding, figuring out what are best practices for infant sleep. What are the different vaccines your child needs to get, and what does that look like? My biggest focus postpartum is there's so many resources for the child and newborn, which they obviously need because they're new to this world. but making sure that the birthing person, the mom, isn't forgotten. Oftentimes in the immediate postpartum period, you're seeing all sorts of healthcare visits for the baby, and it's typical that the mom doesn't see a clinician again until 8 weeks postpartum. So 8 weeks with a newborn, a lot is going on in your life, your mental health, your physical health. And so I really try to make sure I am connecting with my client and checking in with them to see if they should be talking to other types of clinicians earlier than that 8-week appointment.
Oh, it sounds like a very nurturing, comforted person to have with you.
Yeah, we definitely try to provide a space where people don't feel judged, regardless of their relationship status, what's going on with their family. I meet people where they're at. I know that not all relationships work out regardless of if there's a child or not. Like, I've supported people through that. So having a doula is really amazing for folks regardless of what your background is, whether you've had kids before or not. I've worked with folks who did not have a doula for their first child and did for their second, and it made a completely different experience for them. It really is a service and support for anyone, not just first-time parents. Doula really takes a whole family approach, not just working with a birthing person, but working with their partner, working with family members and friends who they consider part of their community, showing them how to support a pregnant person in early labor before I get there. What are the different techniques in terms of massage, meditation, and aromatherapy that anyone can do to support that person. I'm also helping empower the people who are that support system for that birthing person to make sure when I'm gone and no longer working with you, you all have some skills and tools on how to provide that comfort and care that I was holding as a doula.
It really makes me want to have a doula.
Yeah, I'm glad.
Earlier we talked about health insurance coverage and getting a doula and essentially calling the number on the back of the health insurance card to ask your physician's office about accessing a doula. Walk us through sort of that process and what is the cost of having a doula? Unfortunately,
right now, the cost is one of the biggest barriers for people accessing doula services. And one of the reasons why Department of Public Health, I know the Boston Public Health Commission as well, is really focusing on reducing those barriers. So right now, the only major insurance program that covers doula services is Mass Health. So for folks who are on Mass Health, you should be able to reach out to Mass Health and get connected with a doula. For folks on other types of insurance, there may be some existing doula programs. We're trying to make it statewide so that all insurers, regardless of it being private pay or plan you get from the Health Connector or through your job, is covering these services. There are out-of-pocket costs for doula services right now. And those out-of-pocket costs look different depending on the services a doula is going to provide. For me, as a full-spectrum doula, I work with people prenatally and postpartum. That cost might be about $2,500 in installments, of course.
And that's $2,500 for the length that you'll be with that person.
Exactly. Mm-hmm. But for some doulas, they work more specifically just for postpartum, just for prenatal, or just for the actual delivery, and so that cost might differ. There's also, as I said, doula agencies, and a lot of those try to do sliding scales and other types of techniques to make sure that cost is not a burden, because we know, as I described earlier, the positive impact that having a doula in the room has for a birthing person. So right now, it is a barrier, but we are looking into and working very diligently to create a system where insurers across the board are covering doula services.
Does Mass Health provide full coverage as well, or does it vary depending on the services provided?
Mass Health doula program covers doula services across your entire experience, so prenatal, delivery, and postpartum as well. Mass Health covers 40% of births in Massachusetts, so we've made great strides getting Mass Health to cover doula services, but we're still moving forward to get those other 60% covered by insurance.
It's a win to have Mass Health give this full coverage, and we absolutely need other health insurance programs to be able to support doula support cares because, as you said, we know that there are better health outcomes when there's a doula in the space for labor and delivering. So Maya, what's the landscape like for doulas in Boston?
When the pandemic started, a lot of folks were not able to bring as many support folks to the hospital. And we really saw an explosion of folks wanting to work with doulas. Because doulas aren't certified by a statewide body, the specific numbers are unknown. But what we do know is that prior to the pandemic versus now, there's been an explosion in the number of doulas who are trained and certified and working with birthing people in the area. Many of the doulas in the Boston area are white and wealthier, right? So that when we're talking about cultural brokering, cultural humility, and finding people who come from your community, that presents a challenge for folks who are not from white and wealthy communities. One of the things that I'm really passionate about is just describing what a doula is and how to become a doula, because we really need more folks from different backgrounds to get involved and get engaged.
Mm-hmm. And on that note, I would love for you to share more about your work as a program and policy manager at DPH. And you mentioned to us earlier about your focus on really trying to get policy changed. What specifically is that, and sort of why your role is so important?
Yes, so my role is new to the Department of Public Health. And I am working to get this statewide certification system for doulas stood up. That means working with current doulas, working with insurance providers, and working with the legislature to figure out what is the best pathway that meets the needs of all of these key stakeholders. That also looks like amending and adjusting policy and regulations that the Department of Public Health holds around maternal health care. Doulas primarily will meet the birthing person wherever they're at, whether that's hospital, whether that's a home birth or a birth center. Hospital birth is super popular here in Massachusetts. We have some great healthcare institutions. However, there are other options for places to give birth, like birth centers, where midwives and doulas really are running things, versus a hospital setting where it is really much more administered by physicians. My role as a policy manager is to support making spaces that foster positive health outcomes more available. And so that looks like amending the regulations for birth centers so we can have more. Right now in Massachusetts, the whole entire state, we have one birth center, and it's in Western Mass. So for people in Boston, that is really not feasible. The doula piece and the birth center piece are two areas that we're really invested in to try to improve outcomes.
How does one become a doula?
So to become a doula, you would take part in a doula training program. There is a credentialing body for doulas called Doula. They offer a lot of different trainings. There are also some more locally based doula trainings. Personally, I took a doula training program called Birthing Advocacy Doula Trainings. The equity focus was right at the forefront, and it was run by a Black doula whose experience comes from working with incarcerated people. Becoming a doula means that you are going to take part in a training that teaches you about childbirth education, infant resuscitation, infant feeding, comfort measures throughout labor, and the physiology of birth. Once you're trained, you shadow a doula or midwife to get some experience. To become a mass health doula, which means that you can be reimbursed for births you do by mass health patients, requires after you get your certification or also have experience working with birthing people. So there is the formal training pathway and then the experience pathway. Then those are the two ways to become a mass health certified doula.
Maya, is there anything that we're missing or anything else that you think the viewer should know about prenatal to postpartum and then your relationship with the doula?
I think it's just really important for people when they are pregnant, when they are growing their family, to really think about what are the things that I'm scared of, right? And that list might be long, but when you sort of take some time to think about that and think about, well, what are the things that I have in my life that allows me to feel supported? If you're noticing some gaps, chances are you might need a doula. There are a lot of things to be nervous about when pregnant, but having a strong support system and network is huge. And if you feel like you don't have that network, a doula can be a huge part of it and help you build that up as well, so you're not just left hanging. Definitely encourage folks to do their research, try and find doula services. If you're interested in becoming a doula, as I said before, we are really in need of more diversity within our doula workforce here in the Boston area and Massachusetts overall. Really hoping that people take that away from our conversation.
Maia, thank you so much for your time, your knowledge, your expertise. Thank you so much for joining me in the studio today.
Thank you.